Hey everybody, Dr. Mork here again. So let's talk about that first appointment. What do you bring? Well, you can bring your insurance card and a copay, a current list of your medications, and then just be ready to talk. Sometimes a person will make up a list of things that they want to be sure they cover so that they don't leave anything out, and they'll actually refer to that list in the session, and that's perfectly okay. The psychologist or counselor will ask you, what brings you in today? And then you have a lot of freedom to go whatever direction you choose. But don't worry if you run out of things to talk about or there's an awkward silence. That therapist has plenty of things that they might ask about. They'll ask about family of origin, physical symptoms. They'll ask about your childhood and adolescence, your parents' marriage. They'll talk about, ask about current functioning, academically, on the job, where are you living now, current relationships, friendships, social support. So a lot of things to talk about, even if you don't think to bring them up. There are actually a few sensitive subjects that every therapist is going to ask about, and I'll explain why with each one. The first thing they might ask about is substance use, specifically drinking habit, use of other narcotics, and maybe even prescription medications that might be abused. The reason for this is first, just to ensure your safety. If there is any issue of chemical dependency, they may refer you to a chemical dependency counselor or treatment program because they want you to be safe and healthy and sober. The other reason I always ask is because it's very hard to do good therapy with somebody who's under the influence of a mind-altering drug. And so I want my clients to be sober when they come in for a session. Another question that will be asked is around sexuality. The therapist might ask about sexual orientation, current sexual behaviors or concerns, even childhood abuse. The reason for this is because it's relevant information to know to get the full picture of the client, but these are topics that don't usually come up unless asked about. Finally, the therapist is going to ask about suicidal ideation. Specifically, do you have thoughts about death? Do you have thoughts about causing your own death? Do you have current self-inflicted harm behaviors? Or are you angry enough at somebody else that you have thoughts about causing them harm? And this is just to ensure not only your safety, but the safety of other people. Finally, your therapist is committed to two things. First of all, they are deeply committed to ensuring that you have a healthy, safe environment in which you can tell your story and in which you can build a relationship with them. They are not going to set you up for failure. They're not going to set you up and watch you squirm. They want you to feel comfortable and safe. And to do that, the other thing they're committed to is confidentiality. They will fiercely protect your privacy. The only limits to confidentiality tend to be if you threaten to hurt yourself or somebody else, or if you know of a child or a vulnerable adult who is being abused. As mandated reporters, a therapist will have to report that information, but will talk with you in depth before releasing that information. So they want to establish healthy trust with you, and in order to do that, they will fiercely protect your confidentiality, and they will talk with you in greater detail about that in that first or maybe second session. If they don't bring it up, you certainly can bring it up with them. I hope you find this helpful. I'm Dr. Mork. Don't forget to laugh. I'll talk to you soon.